Thank you so much for joining us and for your interest in the allergy postgraduate program at Imperial. We've got a nice discussion and some talks coming up to tell you a bit more about it and answer some of your questions. I'll just introduce people first. So I'm Guy Scadding. I'm an adult allergy specialist at the Royal Brompton Hospital. You've got afterwards Dr. Marta Vazquez-Ortiz, who runs the course and who is a pediatric allergist at St Mary's Hospital. And then before that, we've got Professor Sajal Saglani, who's an expert in pediatric allergy and professor at Imperial College and consultant at the Brompton, who's going to talk to you about allergy and asthma research at Imperial. And then we've got a couple of past students who are going to tell you about their experiences on the course, Drs. Bassoy and Thoresen. So let's get started. And Sajal, I think you're going first. So if you kick us off and tell us a bit more about allergy and asthma research. Thanks very much.
Great. I've got some slides. Marta, are you able to stop sharing?
Yeah, you can share.
Excellent. Thanks.
And this is a message for attendees. So you can post any questions in the chat and we will pick them up at the end with Guy.
Okay, welcome everyone. Really pleased you're interested in allergy and asthma because that's the place to be. It's where it's all happening, especially at Imperial. So I'm going to give you a very quick overview of the research and then use one of our kind of programs as an exemplar of the type of work that we do. I can't cover all allergy and asthma research at Imperial. It's huge. You have to come and join us to understand that. But just to give you a feel, in terms of allergy research, there's research ongoing in the context of food allergy, specifically oral immunotherapy with peanuts being a food that's focused on quite a lot, milk and dairy. And then Marta, who you're going to hear from, is an expert in food protein-induced enterocolitis. She's got a program focusing on that. So lots about food allergy and then eczema. Dr. Claudia Gores, one of our pediatric allergists here, who's working with one of our collaborators in bioengineering, Dr. Tanaka, focusing on computational techniques, looking at how to look at eczematous changes in children as a primary outcome for a clinical trial. Really interesting work that she's doing. And then in terms of allergic sensitization, Guy Scadding, who you've just heard from, who introduced us, is a real expert in immunotherapy and trials of immunotherapy, especially in adults with mechanism incorporated. And they're running a really interesting trial at the moment, looking at a combination of grass pollen immunotherapy with one of the biologicals, dupilumab, to see if we can really extend the benefit and the disease modification. So really interesting work ongoing there. And then house dust mite immunotherapy being another area for research. So in terms of asthma research, we have a big focus on children aged between 1 and 5 with recurrent wheezing, looking at mechanisms, looking at novel therapeutic approaches, biomarkers, how to decide to treat these children. And I'll talk you a little bit through that. And then for school, we've got a big program of research, both for school age and adult asthma. Many of the tutors on the MSc are these people doing this research. We're looking a lot at the use of single agents, combined anti-inflammatory treatments, so long-acting bronchodilators as well as inhaled steroids in one combination. So looking at that kind of treatment and efficacy in children, we've got trials ongoing with that. We have a big program investigating problematic severe asthma in children and adults, but especially in children, a lot of research ongoing with the MDT approach, looking at novel treatments, clinical phenotyping, and focusing a lot on mechanisms. And I'm going to use that as our exemplar of research and how we do translational research here at Imperial, and talk to you about a trial that we're doing with biologics in these patients. And I think what I wanted to emphasize is the approach really is a life course approach. So we're starting in early childhood, both for allergy and asthma research, and it stretches right across through to adolescence, transition, early adulthood, and adults. The research is really all encompassing. And what I think is really exciting is that we have a lot of interdisciplinary research I've told you about just one example where we're collaborating with bioengineers with some of our AI approaches, but we use a lot of data-driven approaches, real experts here that we have. Professor Adnan Chustovic is just one of them, using data-driven approaches with machine learning, computational modeling to understand what's driving asthma and allergy across the life course. And then, of course, we do have clinical trials and basic mechanistic research. So that's just a really quick overview of the types of research ongoing. And I'm going to use asthma as pediatric asthma as one of the kind of examples of how we're doing research. So as you all know, asthma in children, commonest chronic disease affecting children worldwide, with over 1 million children affected in the UK, and a really huge problem in terms of healthcare resource utilization. And then I guess this is the one slide that really is quite alarming, in that in the UK, we have the second highest rate of pediatric deaths from asthma from across the Western world, US and Australasia. So that's a real worry, and that kind of highlights why we need to think about research for asthma in children. And what is asthma? At a very basic level, it's characterized by episodes of acute wheeze, which result from turbulent flow through the airways, because the airways have become narrowed because of a combination of inflammation and structural airway changes. And we measure this, and you'll learn a lot about this on the MSc. We're really getting very, very particular about making a diagnosis of asthma in both adults and children, and the importance of using objective tests like lung function. And this is a child doing spirometry. And on the right, you can see the flow volume loop, and above the x-axis is the expiratory curve, and the black solid line showing the airflow obstruction that we see in patients with asthma, which reverses up to the red dotted line following bronchodilator. So you learn a lot about these techniques. You'll get hands-on experience of doing these techniques, interpreting these techniques on the MSc. And why is it important to look at asthma in childhood? Well, we know that children who have asthma, especially those who have frequent and severe attacks, so the blue squares here and the orange circles here, develop a loss in their lung function very early, by the age of 7 or 10, which then tracks through to adulthood. So the kind of early hit or early insult then tracks, and we don't have disease-modifying therapies. And that's one of the real aims of the program of research that we run here at Imperial. And this is a real very, very basic overview of the pathophysiology of allergic asthma. So we have multiple environmental exposures. Another thing you learn about the importance of gene by environment interactions and the complex multifactorial nature of asthma you'll learn about on the MSc. So multiple exposures that hit the airway wall in a susceptible person, gene by environment, that results in the parallel development of inflammation, and remodeling the structural airway changes that result in that thickened airway wall. And the big kind of overwhelming type of inflammation that we see in allergic asthma is eosinophilia. And how do we know this? Well, some of the research that we've done has really helped us to understand this in children. We have a program of a bronchoscopic program of research. So we see patients with very severe disease, and to really understand what's driving their disease and the mechanisms, we undertake bronchoscopies and we sample the lower airways of these patients, both bronchoalveolar lavage, which is on the bottom left here, and also airway biopsies, to really understand what type of inflammation and how much remodeling is ongoing, so that we can identify targeted treatments. And with this, we've kind of shown that actually in children with severe asthma, that the overwhelming cell is definitely eosinophil. They're kind of jam-packed full of eosinophils, the majority of these patients. And the other thing that's really striking is that they have really severe allergen sensitization. This isn't just a single, little bit of a positive skin prick test to one allergen. These patients have got really severe multiple aero allergen sensitization and food allergen sensitization. Again, you'll learn about the techniques that we use to quantify this on the MSc. And so how do we treat this? Well, usually we would treat eosinophilic inflammation in asthma with inhaled steroids. But the problem here is that despite maximum doses of treatment, these children are remaining unwell and poorly controlled. So two key things really, the eosinophilia in the airways and then allergy really driving it, so IgE. But when we want to understand, is it really all absolutely steroid resistant? To try and understand this, we've given patients an intramuscular injection of steroids to see, is the disease completely steroid resistant? And when we do that, actually we see that if you give high enough steroids, and especially systemic steroids, then there is an improvement in the inflammation, an improvement in symptoms, and a reduction in attacks. But of course, the problem is we can't keep giving these children high-dose systemic steroids because of the unacceptable adverse effects. And this is where the findings that we've had from our research, the eosinophilia, the significant allergy, has really been translatable to the compounds that are now available on the market for these patients. So biologics that have become available, we've got treatments that target IL-5, which are involved in eosinophilic inflammation, and we've got treatments that target IgE. So we're, as a result of that, now doing this trial, which is a national clinical trial comparing two biologics that are available for treatment of children with severe asthma, the anti-IgE antibody, omalizumab, and the anti-IL-5 antibody, mepolizumab, to really understand how they work in children and which biologic is the best for which child. So there's mechanism built into this clinical trial, and we're leading this at Imperial. So just to give you a feel for how we've gone from really basic work, looking at the lower airways of these patients bronchoscopically, to then now a clinical trial to really translate the findings that we have and understand how best to treat these patients. And just very quickly to tell you a big overview of what we're doing for preschool wheezers. So we know that children aged between 1 and 6 have recurrent episodes of wheezing. And what we're understanding more and more is that the earlier these patients have severe and frequent episodes, the more likely they are also to have loss of lung function and develop COPD in adulthood. And this is some of the kind of epidemiological work that we've done on the left here with GP and primary care records. What we can see, unlike asthma, actually the prevalence of acute presentations to primary care of these children with preschool wheezing is going up. So something is not right. We're not treating them very effectively. And if you look at the age of children being admitted with acute asthma or wheeze attacks, the majority, by far and away the majority, 75%, are aged between 1 and 5. So they're a real huge burden for our healthcare system, and we're not very good at treating them. So similarly, we've done bronchoscopic studies in these patients to understand what's driving their disease. And we've shown that as a group, they do have eosinophilia and remodeling. But what's different is that the eosinophilia is very much a yes-no. We've got two kind of groups, a group with definite eosinophilia and a group who actually don't have much in the way of eosinophilic inflammation at all, quite different to the school-age children that we see. And what we tend to do at the moment is just lump all the wheezers together and give them all inhaled steroids. But as I've told you, the inhaled steroids are really targeted to eosinophilic inflammation. So we need to find the patients with the eosinophilic inflammation and treat them with inhaled steroids. And the others, we need to find some other treatments for. And we know that actually to find the children with eosinophilic inflammation, we need to look for allergen sensitization and perhaps use blood eosinophils. But what we know is that 3/4 of these recurrent, really difficult preschool wheezers are actually non-allergic. And so inhaled steroids aren't going to work in them. And that's probably why they keep coming in again and again and again with acute attacks, because we're not treating them effectively. And what we've shown is the non-allergic wheezers tend to have a lot of infection in their lower airways, especially bacterial infection associated with neutrophilia. And we've looked at our group of preschool wheezers in a completely unbiased way with a cluster analysis. So these are some of the techniques we use to analyze our data, and shown two really interesting clusters, a very atopic cluster that seems to be eosinophilic and will probably respond to inhaled steroids, but then this non-allergic infection-driven cluster that tend to have a lot of lower airway bacteria. And maybe we now need to be thinking about these children in two distinct groups, some that are likely to respond to inhaled steroids, but the others that perhaps need targeted antibiotics or some kind of treatment that's going to deal with their infection to try and really get on top of the attacks and the healthcare burden that they form for us. So that's just a very quick overview of the approaches that we're taking and the types of research that we're doing. It's very much translational, going from very basic mechanisms to really important and detailed clinical phenotyping coming together and then applying that all in clinical trials. A very quick overview. I hope that's helpful.
Sejal, thank you ever so much. That's a fascinating overview. It's very nice to see what goes on in the pediatric side of things before the patients come to us. But lots of exciting things. In your trial, were you tempted to have an arm where patients got both omalizumab and anti-IL-5, or was that too much of a good thing?
So that would be when we started the trial, mepolizumab hadn't even been licensed yet for children. It was just about to be licensed, so it was already quite. It's an IMP essentially in the trial. So yeah, 2 biologics is yet another step for children. At the moment, we don't even know in terms of single biologics which is the best one for which patient. But yeah, certainly that would be the next direction, I guess. Yeah.
Fantastic. Marta, do we have time for questions now, or are we going on to the next talk straight away?
I think we probably should go to the next talk straight away.
All right. Well, I'm sure you have lots of questions for Sejal, but we will move on. And Marta, I think you're going to talk to us next and tell us a bit more about the course itself. Yeah,
absolutely. So yeah, very happy to be here and see lots of people wanting to hear about the Allergy MSc, and great thank you to Guy and Sejal for being here as well. So I'm going to be talking now about the Allergy Postgraduate Program, so the MSc, and I've been leading on the MSc for the last 9 years, so it feels like a long time now, but it's absolutely great to be in this position. So I guess the bottom line of you joining this meeting today and hopefully joining the program is you're wanting to become an expert in allergy, and I think this is very much what you get when you join us. Why Imperial? We know there are other courses in other universities, but we're very proud that Imperial is now the top 2 university in the world. That is news from yesterday, and in other surveys, etc., Imperial has ranked very, very well. So the recent Research Excellence Framework, last done in 2021, Imperial was best in the UK, and Imperial was also the University of the Year last year by the Guardian University Guide. So very, very amazing institution to be part of. And I really like these 2 quotes here in this piece of news, saying that, this is a testament to the quality and the commitment of our entire community. And I think this really extends to our students. And we have very, very talented, very motivated students. And it's an absolute pleasure to be part of this, faculty and students all working in the same direction. And you see there as well the colleagues' ability to translate ideas into real impact, and focusing on discovering more about the world, innovating to benefit people everywhere, and educating the next generation of leaders. So I think, these kind of quotes there really capture the essence of what Imperial is about. And sometimes, people might think, it's a competitive environment, etc., but very much in our program, I feel it's not. Students are really supportive of each other, and it's a very sort of nurturing and sort of sharing open community that we establish. So don't be scared to come to Imperial. It might sound a bit too much. And we kind of like to say that in a way, Imperial is the home of allergy. There's been absolutely outstanding contributions over the years in the institution we're in the hospital we're in. And you might be aware that sort of the first attempt of doing immunotherapy was done at St. Mary's Hospital over 100 years ago by Noonan Freeman, and the first publication on that treatment. And then we had outstanding figures decades ago with Dr. Bill Frankland, who established one of the largest allergy services at the time across the world at St. Mary's Hospital, ran the first randomized controlled trial in immunotherapy, first pollen counts in the roof of the hospital, etc. And then people like Professor Barry Kay, who did amazing contributions to our understanding of the mechanisms of T2 asthma that have then paved the way for new treatments like biologics. And we're very grateful that we've been able to launch the Frankland K allergy center at NHLI at Imperial very recently, which is dedicated to advancing allergy research, and the Allergy MSc education is very much part of that. And you might be aware that we at Imperial, we rank second in the world after Harvard in allergy research. It's very much a very sort of rich community doing lots, in terms of allergy research. So, and that allows us to have world-class teaching. We have world-leading experts like Sejal, and you might recognize lots of familiar faces in the field of allergy there that are our module leads. So people like Steve Durham, Adnan Kustovich, Andy Bosch, Paul Tanner, Bob Boyle, Mo Samji, etc. And we have an extensive syllabus covering all the different areas within allergy. And we have a very innovative, student-centered, active learning approach. So you learn a lot by doing, by practicing, by discussing, by bringing questions, cases, etc. And it's very flexible. It's a part-time program, so most of our students work alongside studying. And that's possible because it's flexible. You can follow purely online or in the blended stream, which we will see later means that you do a good chunk online, but then you come on campus to London 3 times a year in year 1 and year 2. And it's very much an international flair. Both the faculty, we have quite a few really well-renowned external international speakers, as well as our faculty, and our students are as well pretty international, which is very rich as well. So how our students like? So we have quite a few healthcare professionals, but not only. So within healthcare professionals, we have doctors from different specialties, pediatrics, primary care, allergists, dermatologists, chest physicians, ENT and other specialties. We have always some specialist nurses working in allergy, dietitians, biomedical scientists, so people working in the lab or focused on the lab. And other people from other areas like epidemiologists, so people working in industry or entrepreneurs in the last few years. And if we look back at the last 5 years, we've had around 100 students, 40% from UK and Ireland that now, since Brexit, qualify as home students. Okay, about 20% from other European countries and 40% from, say, overseas, from far away. Okay, and if you see kind of the number of countries we've had, you see, you know, a wide variety, and I think it makes it so rich, because of course allergy presents differently in different parts of the world, and we want to capture that global aspect of allergy, and also how things are managed in different ways, partly because they present differently, partly because the healthcare systems and the populations, the cultures are different, and we very much capture that international aspect. So what's the structure of the program? So someone was asking, you know, in the questions you sent beforehand, what modules do we have? So the program is structured in 3 steps. So the year 1, everybody starts with that, is what is the postgraduate certificate, and there you have 3 biggish modules. Okay, so the scientific basis of allergy. This is about the immunology and the mechanisms underpinning allergy and the different allergic diseases, and how that relates to the clinical presentation, to the diagnostic tests, to the treatments. And, you know, it's a very sort of in-depth module, very rich, with lots of great international speakers. And then we move on to something much more practical and clinical, the diagnosis and treatment of allergic disease. So it's like, what's best practice, how things present, how things are diagnosed and treated in practice. And then we move on to the last module, the cutting edge of allergy, which is about what's new in allergy, in research, generally with impact, clinical practice and future research. And importantly, we also help you develop research skills to critically appraise the literature, but also to set up to do your own research studies. And then you could exit with postgraduate certificate, but most of the students continue with that. So in terms of module leads for this first year, we have Mo Samji and Adnan Kustovich in the first module, and the module lead for the second module. And then the cutting edge of allergy module, we have Bob Boyle and Paul Tanner. So most people then continue to year 2, and there you have 5 modules, 1 bigger module, which is the food hypersensitivity module. So it's all about food allergy and the differentials. Then we have rhinitis, rhinosinusitis, and immunotherapy, where Guy Scadding and Steve Durham are module leads. We have the asthma module with Sejal, Andy Bush, and Louise Fleming as module leads. We have allergic skin disease and drug allergy with Tim Watts as module lead, and then pediatric allergy, where I'm module lead with Ellie Minshall. And in all these modules in year 2, we go in depth about the complexities of all these different disease areas, pathophysiology, clinical presentations, or complex presentations, complex diagnostics and treatments, and sort of very much with a multidisciplinary approach, and touching on the controversies, on the difficulties, etc., and where the research is heading. So much more detail about all the different disease areas. And again, people can exit at that stage, or continue with us to do the MSc, the full MSc, which is then completing the research project. And people have the option of doing that research project within the second year alongside the other module, which is quite demanding. So you have to think that this could be a full-time MSc. So each of these 3 steps is a third of a full-time, say, employment or program. Okay, so that will be, doing the modules and the MSc in 1 year is demanding, but some students do that successfully. So how do we teach? So things have changed over the years, and I think definitely for the better. We have a very sort of flexible and effective way of teaching and learning. So you can join us for the pure online stream, where you don't have to come to London at all. You follow everything online, or you can be in the blended stream, which means that you have quite a bit online together with the online stream, but then you come to London on campus 3 times a year in year 1 and 2, and that is for 1 or 2 consecutive days of teaching. Okay, in terms of the materials and the type of teaching you have access to, so we have quite a lot of online materials that are asynchronous. That means that they're there and you access them in your own time. And that's pre-recorded content like lectures, mini lectures, interviews, podcasts, practical demonstrations or simulation. You have reading lists, you have web-based resources, you have interactive exercises and tasks we allocate to you to then pick up in the live teaching to discuss, okay? And then there's quite a lot of live teaching as well for people in the online stream. That's all online. And for people in the blended stream, part of that is purely online as well with the online stream, and part of that is what we call hybrid. That means that the blended students are on campus and the online students join online. So we call it hybrid because we have students sort of in 2 ways at the same time. And that's very much for interaction, for discussion, for Q&As, for case-based discussions, or discussions of complex scenarios, workshops, role play, simulation, lots of group work. So you get allocated to a group with kind of a bit of a multidisciplinary approach at the beginning of the year, and you do quite a lot of work within the group, which is really, really helpful. Lots of peer support, peer learning there. And then you have quite a few student-led sessions where you present, you prepare some work, things like journal club, pro-con debates, or poster presentations, oral presentations. And the people in the blended stream do hands-on practical sessions on campus. And those learning outcomes are covered for the online stream with practical interactive exercises online. So you get to see those things and practice those things in a different way. So this is an example of how a module is organized. So we always launch the module in a webinar to introduce and present the module. And then we give you a bit of time, about 2 weeks, to go through the materials. And we start with a set of online half days in week 3, 4, 5. And then we have the hybrid day or hybrid days for the module. And about 4 weeks, once the teaching has been completed, you have your assessment. So you have time to prepare for the assessment. Okay. Types of assessment, there's a wide range of assessments, and it's very much to help you develop skills for your professional career, things that you probably would like to do or do better. Okay, and the things from a written exam on sort of immunology heavy to a written case report, running a mock allergy clinic, writing a research grants application, presenting a poster, doing oral presentations, doing a complex case group presentation, doing an info event for patients, writing a review paper, doing a case-based quiz. And for those doing the MSc thesis, it's an original article format. So it's very easy now for the students to kind of shorten that a little bit and send for publication. And many of our students in the last few years have published their thesis. So this is how the asynchronous materials look like. So we have a platform called Blackboard that we share with many other programs in the faculty, and this is where all the materials are sitting, and you get for each module one of these busy colorful tables with all the different sessions, all the different topics we touch on, organized by themes, and you click on the click here to watch any recordings, access any materials, and you can find quite a few tasks to work on, a few mandatory, others, most of them non-mandatory, to kind of put things into practice and prepare for the live teaching. Okay, so this is how different sessions might look like. So you access and you find there the links to recordings, papers to read, etc. So also asynchronous materials. So this is more like the practical stuff that you can access in your own time. So we have lots of interactive exercises. Guy's not there, but he could be there. He's done a few as well. So we have sim scenarios, we have consultations, cases, quizzes, interactive diagrams, we have practical demos, we have virtual tours in the lab, in the research unit, in clinic, etc. And this is how the live teaching, so the synchronous teaching looks like. So this is when we're all online. This is when we are hybrid, some people on campus, some people online. And I've just circled Bisu, who's going to be with us in a second, sharing her experience, and lots of ways of allowing interaction anonymously and non-anonymously, putting your hands up, of course, and talking, but lots of ways of gathering feedback and doing quizzes live, etc. with the students. So this is what we do with the on-campus people when they come for the hands-on practical things. So this is anaphylaxis in training, practicing with all the different eczema creams, doing nasal endoscopy, doing skin testing, and then practicing with different sort of foods for food challenges, etc. So very hands-on. In terms of funding and funding opportunities, we get asked about that quite a lot. So we offer scholarships. So the Faculty of Medicine offers their own scholarships that are open to everybody. I think the deadline is generally end of April. And we offer our own scholarships purely for allergy. And you can see there, we offer one that is 3K, 3 that are 2K. And this is to cover the postgraduate certificate fees, so the fees of the first year. And then very generously from a charity, we have a bigger scholarship to complete the full MSc, to help complete the full MSc. So if you're interested in applying to the scholarships, hurry up, because we're closing on the 19th of June. You have to submit an application for the scholarships, but also apply to the program. Okay. So what do our students do afterwards when they finish with us? So a range of things. Of course, we have quite a few clinical people, and they generally go into more specialized and more senior clinical role, often in a tertiary service, which in a multidisciplinary team. They're often the lead clinician. They often sort of lead the team. They might be the lead nurse, the lead dietitian, the lead consultant, or they might be a GP in primary care with a special interest. And quite a few people do private practice purely, or some private practice alongside, because there's so much demand for allergy being such a common disease and being, you know, much more awareness. Some people go into research, or they're already in research, and they complete an MD or a PhD and go into the career path of being a PA, a PI, a principal investigator. And then often you see that, you know, within research, doing the MSc, it's meant to people having job opportunities or career progression opportunities. And we have people who have gone into being in a position of a lead allergy research nurse or a senior research fellow, or, you know, they've gone into a PhD fellowship session, or they've moved to industry, etc. And again, in industry, job opportunities or career progression. So we have people who are now clinical research physicians, in industry, medical advisors, or kind of more senior positions in terms of management or leadership. So that's the MSc. So it's very much, all very evidence-based. What's best practice, but also very, very aware of the knowledge gaps, the controversies, the pros and cons of everything, and the dogma that often there is in allergy, that you look for the evidence is not there, but everybody's convinced that things should be done in a certain way. So, you get to that sort of expert level, really knowing all the ins and outs of everything. Okay, so I'm gonna move away from the MSc now and moving into the clinical services, just to give you a bit of a snapshot of the clinical services feeding into the allergy program. So it's very much services based at the Royal Brompton, where Sejal and Guy are based, as well as at Imperial NHS, which encompasses 5 hospitals in central London. And it captures clinical services, pediatrics and adults, allergy, respiratory medicine, dermatology, gastroenterology, ENT, but also all the colleagues, okay? And these are some of the pictures of the hospital, so all kind of quite historic and nice, etc. And this is where we're based, in this sort of kind of childish map of London. We've always been based at St Mary's Medical School, and from now on, we're going to be based probably more and more at the Brompton and South Kensington, so just across Hyde Park, in a very, very nice location. Okay, so I'm just going to talk to you about the pediatric allergy service where I work as a consultant. So that's mainly based at St Mary's, is the Imperial NHS Pediatric Service. We're one of the largest tertiary referral centres in Europe. We're a World Centre of Excellence. We are a very multidisciplinary team. We have doctors, but quite a few nurses, dietitians, speech and language specialists, psychologists. We're very happy to have and very lucky to have a psychologist. We have very strong links with dermatology, with gastroenterology, with respiratory medicine, ENT, and general pediatrics. We do some joint clinics with some of the specialists. We have transition clinics for adolescents, etc. And we see many kids a year, over 6,000 a year, with the whole spectrum of allergic diseases. We have a focused interest in complex patients, in holistic care and patient education. We have very strong evidence-based practice. We have translational research embedded into our practice with a clinical research facility that Paul Turner leads. And we feed into the food immunotherapy studies, the anaphylaxis research, etc. We are a great training centre in the UK. We also do SPIN training, and we have international fellows, and we're the lead for North West London Network for Allergy. I'm not going to touch on the allergy service because Sejal did a lovely overview of the research and how the clinical service fits into that. So that's all from me. So very much looking forward to hear from our students, and thanks for listening.
Marta, thank you very, very much. There are some questions coming in, and we will do our best to cover those either in the chat or at the end. But we'll move on to Dr. Bengisu Basoy, who's going to tell us a bit more about her experience as a student on the course.
Thank you, Guy, and thank you, Marta. So my name is Bengisu. I currently work as a consultant pediatrician at Darnat Valley Hospital, and my main interest is a pediatric allergy and pediatric asthma. So this is to be honest, as a student, this is the first time I'm listening Marta's open day, but I have been in this, the open day twice before. So it took me 2 years to convince myself that I'm going to join, and I still believe that this is the best decision I have ever done. So I've completed my end of my year 2 now, so about to complete my last modules. So the course, it's very well structured and very well organized. So I wanted to improve my experience and get a little more in-depth knowledge about allergy and asthma. And I have done couple of other courses, and I always found those ones very superficial, so some I can apply to my practice. But since joining the discourse sessions, so it gives me really good knowledge, experience, and whatever I learn from the sessions, I can apply to my the practice almost on the same day. So one thing much I love on this the course is to you have an opportunity to get the sessions and lectures from the world leading expert on their fields. So it's just all over the world, so not just in the UK, which was so amazing. You have an opportunity to ask any questions to them, and faculty was great, so they will accommodate all of your needs, and they are so encouraging and enthusiastic. Even their enthusiasm just encourage you. So the other best thing is on this course is you're going to have your groups, and you're going to be divided into groups. So on your group, so there might be dietitians, the doctors or nurses, and that within that group, you're not going to feel alone at all. So I did have this similar anxiety and similar concerns that how I'm going to complete all these modules, how I'm going to do my assessment. But once you contact your, the group colleagues. So you will realize that everybody is in the same place, makes you put in a bit of an ease positions. And being in the group just encourage you more. And within the group, we also learn quite a lot from each other. So I think this is another best part of this this course program, is to be divided into the different peer groups. So what I found also, the faculty is always great and it's always approachable. So they don't have any limits at all. So whatever is the question you ask, even within the sessions or without the sessions, you will always get an answer. You will always get a response from them. It's always, there's a good interaction sessions, not just the faculty with the lecturer. You also have an opportunity to interact within your the group team members. As Marta mentioned, that are all over the world. It's not in UK, so you'll get an opportunity to learn from everyone from their the experience from the Europe, the Asian. Australia and the Canada. We have the students from all over the place. I think since the coming to end of my second year, I feel that my knowledge experience increased vastly. So what service I offer to my patients, it's huge. It's not just the patients. I believe the patient find benefit. I also help with my the colleague to learn, and as well as the trainees that come to visit our service. It's a very well-known fact that the training for an allergy is very limited, both undergraduate and postgraduate. So having the knowledge and experience and expertise, the knowledge on allergy on my department, I believe that my colleague, the patients, and as well as the trainer, junior doctor coming to my department, finding a great benefit. So I would highly recommend, if you have any single doubt, I would highly recommend you to join it, because you're not going to disappoint, definitely.
Thank you ever so much. That was wonderful to hear. Jason, you're going to join us from the beach and tell us a little bit more about your experiences of the course. Thank you.
Cool. Can everyone hear me? That's great. Yeah. So I just want to say I'm here in South Africa. You guys might have not heard in all the others there that South Africa or Africa was included. So welcome to Africa, everyone. And thanks for joining. It's such a privilege, just an honor to be here. And I just want to say thanks to everyone. And I'm going to be a little bit more chilled when it comes to talking about this. So don't be afraid about all the immunology and everything that's been going on. These are things you're going to learn along the way. I've got a few disclaimers because I am South African. So just 3 disclaimers. So just remember, if I say how's it, it means hi. If I say yeah, it means yes. And if I say lekker, it means nice. Okay. So just for everyone, I do apologize. I cannot speak the Queen's English just yet, but I'm getting there. And so I want to start just quickly. I just want to read you a few names. So, if I read these names out. So we got Dr. Marta Ortiz, Dr. Bob Boyle, Prof. Annie Bush, Prof. Adnan Kustavi, Prof. Stephen Durham, Prof. Sejal Siglani, Prof. Garskedding, or Dr. Garskedding, Dr. Louise Fleming, Rosa Mayer, Dr. Elena Minshall, Dr. Nisha Patel, Dr. Isabel Scarpala, and Prof. Moshamji, Dr. Paul Turner, and Dr. Tim Watts. So, it's one of these things that I go like, when I started this course, it felt like I was a kid on Christmas Day, because you're dealing with some of the best allergy specialists in the world. So it was so great for me. So I'm very privileged to be able to be in contact and learn from the best in the world. And congrats to all of you guys for, I saw in the last 24 hours that we've gone up to number 2 in the world, which is great. So I'm a general practitioner from South Africa. I do practice in the private sector, and I mean we've got a lot of it's tough here, and so I'm glad to be on here because we don't have load shedding at the moment. So load shedding is that our electricity gets cut off between 6 and 9 hours a day, which is quite interesting. So my laptop can be charged so I can chat with all of you guys. And so, I just want to share my bit of an experience. And then I think for, who never gets mentioned, just one of the unsung heroes here, he's also Tamsin Moala. And I think that if you guys need anything, I mean, she's the crux of this whole, and Marta being the program director. Thank you for everything you guys do. So if you guys need anything, I mean, Tamsin will message you within a heartbeat if you need anything. So, I started my journey. I was applying for this course in the UK, and they responded very quickly. And I think if you have any interest, I've been practicing allergies for 5 or 6 years now, or trying my best to practice for what I thought was allergies, until I got into the course. And so don't be a bit frightened about what you've heard so far, because you will learn everything along the way, and if you have a good interest in allergies. And so with regards to, there's some of the questions that popped up, and about time, everyone's worried about time. So I'm married with a 9-year-old boy, and my son turned 9 yesterday. When it comes to time, when you're interested in allergies, I promise you don't have to worry about time. The courses are, you just want to do more. So it's all online. Is one of the only courses worldwide you can do online, and you can actually experience a practical experience and both an online educational experience, compared to other fields like anesthesiology and all of that, And so I'm very grateful that I've had this opportunity from the best in the world. And so I think along the way you guys will experience and get the best knowledge, the most up-to-date knowledge, and so especially in our last block, we're doing the cutting edge of allergy. And one of the things in South Africa, I studied at Stellenbosch University, and we are very practically placed. We can do plenty practical things, but what happens is, and I'm very glad to be out of my comfort zone in that I've come back to learning a lot about research. I'm not the greatest at it. I'm very bad at putting things on paper, I'll tell you that for sure, as my marks may show, but I'm getting there. But still, it is something that we need to learn as practitioners and do better for our patients, at the end of the day. And so if you have a big interest in allergies, I really, really, really advise you to please go forth and apply for this course, because it is something you'll never regret, and it's something that we cannot chat about in an hour and anything like this. I mean, unfortunately, Marta and Dr. Skelly and them, they cannot just give you everything in an hour. And we've got such great groups. I've met some of the greatest people in the world. We have groups of, we've got a total group of 25, 26 at the moment, and we're separating groups of 5. But, I've got to learn a lot about not only allergology in itself, but also about people and how they practice, and they've got to learn about me here in South Africa as well. And it's been a phenomenal experience. And the one thing I can say, the one thing that I'm so grateful for is that, you're chatting to some of the greatest specialists in the world, but for the first time in my life, I've never been treated as an inferior, and these specialists, they talk to you like human beings. And it's been so great for me that you can, anytime, any day, you can message, email, do whatever you want, and you will get a response within a period of time. And you don't have to stress about those. So don't stress about, the immunology block comes at first. It gets you guns blazing, but it will, it's the basis of allergology and the basis of medicine, actually. So I'm just very grateful, and I'm very happy that if anyone, Tamsin or Marta, anyone can send them my email or my phone number. I'm happy to chat to anyone, especially being an online student. It's been so great. And don't be afraid about, that you're not going to experience the practical experience, because actually you get the most practical experience even being online. I still feel like I'm there, you know, those little bits and pieces you can learn in your own time, and it's been phenomenal. And so, you know, if anyone wants to contact me, we can have a chat. I'm happy to talk on the phone when we have electricity. That'll be great, and I can charge my phone. But yeah, so you know, if there's any other questions, it's been a phenomenal experience for me. I've learned, my practice has grown phenomenally, and it's not to say that I've got some of the greatest specialists here, which Marta, and I'm sure Dr. Scally will know that. I mean, I'm learning under, you know, Prof. Johnny Peter and Prof. Mark Levine and all of those guys, and we've got a great community here. But this just opens up the gates just for interaction around the world. And I think allergies worldwide is just underrated, you know. And I came into this course, you know, prior to this course, even when I came into allergies as a general practitioner, you know, one thing you learn is that you go, okay, cool, you got allergies, you can do an IgE on everyone, and that just means you got allergies. Okay, well, actually not. So yeah, I just encourage you all just to take part. You're going to learn from the best in the world, and you'll never regret it. In time, you will have lots of time. Okay, so it just depends. If you procrastinate a bit, maybe like me, but you will have lots of time. So don't stress about that. And yeah, thanks for having me. I really appreciate it. Please feel free to contact me with any other queries or concerns. And thank you for everyone for having me here.
Jason, thank you very much. That was wonderful, wonderfully enthusiastic. I'm very, very grateful to you for speaking for the course. All right, so sorry, you've heard plenty about the course and what it involves, and I see Marta and Tamsin have been answering some of your questions in the chat. We had some questions sent beforehand, so we will run through these. So now I'll start the ones in grey. I think we've already answered. So I'm going to go to the ones that have not been highlighted. The first question is, if students take part in the online format, will the final certificate mention the method of studies being online? Marta, I think you can answer that.
Yeah, I'm happy to go through the questions just in the interest of time. So the answer to that is no. So the final certificate you get doesn't say if you've been in the blended stream or the online stream. Guys, is that okay if I just go quickly
you keep going.
through the questions? So someone was asking beforehand, what's more beneficial, you know, what step, diploma, certificate, MSc, and we've had a similar question in the chat now for someone who's a registrar in pulmonology. So it very much depends on where you want to go with your career. I will say I don't see people at all stopping at postgraduate certificates, and I wouldn't stop there. I think at least the diploma, and it's only the people who don't have an interest in doing research in the context of their busy lives that stop there at PGDip, or they cannot do the research at that time. But otherwise, most people want to continue to do the full MSc, because by the time you get to the end of the postgraduate diploma year, you've learned so much about all the different disease areas that often you have a clear view of what you would like to do as your research project, and you've learned so much about research skills, reading the literature, that you're in a very strong position to do your research project, and it's so fulfilling. Lots of our students do research projects in their own institutions with our support, or you can opt to one of the Imperial projects we offer, and that can be clinical research projects, can be wet lab, can be dry lab, say with databases, etc. Okay, so lots of the projects are remote, so there's lots of opportunities. So I will say at least diploma or MSc. Okay, so next question is about GP. So a primary care physician wanting to go into special interest in allergy. So absolutely, I will say at least diploma to have all the different sort of areas covered. And we've always had GPs in the program. The next question is very similar. Someone who did uni in Spain and then moved to the UK to train as a GP. Can I apply? Absolutely, you can apply. Okay. And then there's a question here and also in the chat about how many hours per week. Okay. So as you heard, you know, it's very flexible. So people really organize the time as it best suits them. So some people do it in the evening. So people have days off from work and they do it in the Monday that they have off, or they do it at the weekend. Okay. and you could work steadily and roughly, use the same amount of time pretty much every week. And some people do it in chunks, before the assessments and before the teaching days and all of that. So it's very flexible. But I think it's like, bear in mind, this is 1/3 of a full-time program. So I will say roughly a day and a bit a week in terms of working hours. Okay, so that's sort of kind of the average. But as Jason, and Bengisu, most of our students work full-time or nearly full-time and have busy lives, family commitments with young kids, etc. And what days of the week? So you've seen the structure, like we do, like half days, etc. So we try and not do it on the same day of the week every time, because then people just do clinic on a Monday, and then it will be very messy for them. So it changes. So it can be usually not a Tuesday, but then it changes. But we already have the dates for next academic year. So for people who are registering for the course, we share the dates, so they already have the dates for next academic year, and they can plan accordingly. So someone asking, which is a question we often ask, is there an option to make an external rotation at the allergy department? So as part of the MSc, you don't come and sit in clinic with us, okay? That's not included. But I really think that you get, all the bits that you will get in many, in years of sitting in clinic, you get them in the MSc, because it's all so curated and so kind of designed, so you get the whole experience. But if you want to observe with us, that's completely separate to the MSc, and you can apply for that separately. And I happen to be the one who coordinates that in the pediatric department where I work. So, MSc students kind of have priority for that. So that's separate, and you can rotate anything between 2 weeks and 3 months with us. Okay. And then someone asking about short courses, and there was a similar question in the chat. So some of the modules we have are offered as short courses, and you can just join the short course. I will say, it's great, but the experience is very different. So I don't think you have that experience of course, the whole overview, the holistic overview of everything, and that sense of belonging and being part of the community with your students, with your groups, and with us. But some of the modules are available as short course, and you can find that on the website for short courses. So that's all from me, Guy. I think we're kind of okay for time. I don't know if there are any new questions in the chat. So, Guy, I see a couple of questions in the chat. I'm just reading quickly. Okay, someone wanting to introduce themselves. Hi, Octavio, nice to read your message. Okay, education level requirements. I think, my colleague Tamsin, who's super efficient always, has put all the links there. So, Guy, anything else there?
No, I don't think so.
Great, lovely. So we can wrap up then.
Yeah, great. Thank you all ever so much for attending. Thank you for your interest in the course. And look, we hope to have the opportunity to meet you in due course.
Okay, Guy, I just wanted to add a couple of things. So deadlines for scholarships is the 19th of June, and you need to have submitted your application for the scholarships and the program. And deadlines to apply to the program for most people is end of August. Only for overseas students wanting to join the blended stream, that implies coming to London, deadline is end of July. Okay, so it might sound far, end of July, end of August. You have to put together quite a few bits in the application. So please don't leave it last minute, because sometimes it's disappointing. Okay, so just encouraging everybody to do things as soon as possible so you can make it. Okay, thanks so much.